Good evening, everyone. Welcome to today's HEIA webinar featuring Talia O'Brien. I'm Peter Craig. I'm from HEIA ACT, and I'll be hosting today's session. It's a pleasure to have you join us today, where Talia is going to discuss her research on adolescent nutrition. Today's webinar is being recorded and it will be available to access through the HEIA website. Before we begin, I'd like to acknowledge the traditional custodians of the lands on which we meet today. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples joining us. I'm coming from the land of the Ngunnawal people here in the ACT, and Talia joins us from the land of the Gadigal people of the Eora Nation, and she's in Sydney. So just to introduce our speaker, Talia O'Brien. So Talia is an O'Malley Scholar. She's an accredited practicing dietitian with expertise in evidence-based nutrition and digestive health. She combines science-backed insights with a practical, compassionate approach to help empower individuals and communities to make informed food choices. Talia is passionate about nutrition education and supporting sustainable, healthy eating. Today, Talia will be sharing key insights from her recent research, which explored how adolescents are accessing and interpreting nutrition information in today's digital landscape. This session will unpack the influence of social media, the reliability of online content, and the potential risks and opportunities for young people. Talia will also reflect on her placement at Alice Springs Hospital, where she will offer a valuable perspective on delivering nutrition care in remote and culturally diverse settings. So welcome, Talia. We'll run this session today through a Q&A. We thought that would be a more engaging and interactive approach to hearing about your research. So my first question, I'd like you to tell us a little bit about your background and what inspired you to focus your research on adolescents and digital sources of nutrition information.
Okay, well, thank you so much, Peter, for that beautiful introduction. And I'm very excited to be here and talking to you all today. Really great question to start off with. I've always had a passion for research, and I did know pretty early on that I did want to pursue a PhD, but I also really wanted to help people and was very passionate about nutrition. So studying dietetics did give me a really great opportunity to be able to have a clinical lens as a practitioner, but also to complement that goal of going on to do further research, given that my Masters of Nutrition and Dietetics actually had an integrated research component that would later qualify me to go on and do a PhD. So that was very exciting, and I actually was fortunate enough to have been accepted into one, which is awesome. But my research project, I was basically given some options, and I have always been drawn to working with younger generations. Adolescence is a very critical window, and it is when key health habits are usually established. So the quality of dietary choices can begin to decline. So it is a really, really critical window, and getting it right during this stage can have really big implications on long-term health outcomes. So that can include the prevention of chronic diseases later in life, like type 2 diabetes and also cardiovascular disease. I also think that this project, so it did have that digital angle, which is very relevant today, of course. I've always found digital sources and environments particularly fascinating. Basically, as soon as we have some research, it's pretty much already outdated because it's constantly evolving, and especially AI, I think, is super exciting, and seeing how that really is changing the game of where people, especially young people, are searching for nutrition information. So today's adolescents, they are digital natives, and of course navigating environments that are very complex, whether that be AI or even social media. So that's something that did really draw me towards this research. And even now, I actually work in a private practice setting, and it's become more relevant. A lot of people do come to you if any of you are kind of studying nutrition or dietetics or even some other profession. I think being familiar with the digital landscapes that the people that you are working with, whether that be adolescents or someone else, is really important as a practitioner and any client-facing role.
Thanks for that, Talia. I'm interested in what the main aim of your scoping review. Can you briefly explain what a scoping review is and why you use this method?
For sure. So the aim of our review was to when I say our, I did have a research partner. And the aim of our review was to map the existing literature and also to identify and evaluate the digital sources of healthy eating knowledge that influence the dietary choices of adolescents. And we chose to hone in on the age group of 12 to 18 years. And the reason we chose a scoping review is because a scoping review is kind of thought of as a type of knowledge synthesis. So it basically maps, explores, and summarizes a breadth of literature on a topic. So compared to a systematic review, which answers a more narrow, tightly defined question, a scoping review is broader. So it's designed to have a look at a broader field, especially if that's something that hasn't been explored a whole lot yet. And that will then allow us to establish kind of what the key theories and concepts might be and where the gaps lie so that future research can really hone in and focus on some specific things that might be identified in that scoping review. So this method was basically chosen because the topic is so broad and digital environments are so broad, and we just weren't ready to focus on one specific facet like social media or AI.
Okay, that's super. That's definitely broadened my understanding of the scoping review. Thank you for that. I'm curious now in the types of digital platforms that you found adolescents are commonly using for nutrition information.
Yeah, so the studies that we did include, we actually found them to be really heterogeneous. So I guess when I say that, I mean that they were all very different. And that, to be honest, was a little bit of a challenge in us establishing trends with our research. So for example, out of all of the studies scanned, we only ended up including 36. And if you think about how many different digital sources there are out there and the fact that we included apps, websites, also platforms specifically designed for interventions and social media, then there was a really big variety in there, but I guess it was hard to synthesize a solid evidence base. But basically, we did find that applications adolescents were using, well, for one, of course, social media, especially things like Instagram, TikTok, Facebook, YouTube, and even WhatsApp. We also saw some custom apps developed for specific interventions, and people were looking towards things like MyFitnessPal as well. But then there were also adolescents engaging with online web-based programs and things that used like gamification or even telehealth, more in the studies that looked at specific interventions in particular. But then we did also see applications with AI chatbots and things like that as well.
And so, what were some of the most surprising or important findings from your research?
Yeah, so I think just following on from that, one thing that surprised me the most was the fact how limited research was in that specific area. I think going into the project, I would have, and especially since the first stage of our screening, we had 17,000 different results. But then, of course, narrowing that down to only 36 studies, that was genuinely surprising for me. I did think that we would have many, many more, especially studies that, considering how much there is out there on social media, but there was really only a handful, which I guess made us realize in the big picture that there needs to be more research done in this area. And I think that's really exciting. But that's definitely something that did surprise me.
Yeah, and I guess also leading on to that, thinking about how the social media, what are they calling it now? Not a ban, a delay, how that might impact things in the future. It was just something I was thinking about now. Although, yeah, and how many adolescents are able to get around that. So yeah, things are changing, aren't they? Quite quickly in this space.
For sure. And I think that's
Yeah,
really interesting to
sorry.
see.
Yeah. So, did you find that online nutrition information is generally reliable for adolescents, and why or why not?
So reliability isn't really something that we looked at. We were more looking at where adolescents source their information from. But even so, we still had to, of course, read the papers, and often in reading that, we would see what conclusions the authors did draw, especially if that's something that they were also looking at. And what we did find was that reliability did vary considerably depending on the source. So even though that's not something that we did specifically look at and probably can't make a solid statement or judgment on, because it's just not something that we analysed, I think like our findings still do highlight some concerns. So studies as well, like especially social media ones, where we even had one study that found less than 4% of images related to diet searches on Instagram had meaningful nutrition information. And that is really worrying, especially given how many adolescents are searching those platforms, or likely searching those platforms for nutrition information. And I think that also just comes down to how unregulated certain platforms are. So, for example, as a dietitian, we are, especially as an accredited dietitian, we have not only just been to university to study nutrition for a long time, but we are also governed by like Dietitians Australia, and we have to draw our practices from evidence-based and well-supported research to make sure that we're not saying anything really incorrect, but anyone who is posting on Instagram doesn't have those same boundaries. So it's really hard for young people to distinguish reliable sources.
And that leads into my next question. And you've also touched on the fact that you didn't look so much at the content, but of course that was kind of a side part of what you did, because your research, because you did have to review the papers. But can you, in terms of the biggest risk to adolescents relying on social media for nutrition advice, would it be the fact that anyone can post information out there and from any background? Is it just purely, do you think it's about the unreliability of the information that is out there for adolescents, or is there another risk for our young people relying on social media for nutrition advice?
Yeah, so that's a really great question, and I 100% would support that. I would say most likely the biggest risk is just how unregulated nutrition information is, because anyone can really position themselves as a nutrition figure online, and we even see that, like, not something that I've identified in my research, but just as a consumer of social media content myself. We see someone who has a lot of followers and immediately think that we should trust them, but that's not necessarily the case. And I think it is so hard for people to distinguish between what is correct and well supported versus what is just someone's belief, and what someone might be saying just to get your attention. And I think that's where we can really come in as practitioners and as clinicians, or just people working with young people, and help them to kind of discern what might be good to listen to and who to trust and what to probably avoid. That's probably one of the biggest challenges that I think we will continue to face as social media continues to become a really prominent part of how we look and search for information.
Yes. And I know when I was first studying many years ago, even before social media, it was still mentioned back then. It's like we're all consumers of food. So we all think we know, and we do know about food, but do we really have that top level nutrition knowledge to be able to put information out there? And now that we've all got access to social media, it's easy for us to just to post, oh, I think, and this worked for me, and then attract followers that way. So it is the issue hasn't changed. It's just gotten bigger now that we're all exposed to this information quite easily. And yeah, in terms of who's putting that information out there, the fact that we've got the accredited practicing dietitian, the scheme, so the APD is great. Nutrition Australia, Nutrition Society with their registered nutritionists. So yeah, just I guess continuing to promote the fact that we need to be getting this information from properly qualified nutrition professionals. So just, I guess, agreeing with what you're saying. But yeah, I often see things posted by someone saying that they're a nutritionist, but you will look at their qualification and it's not really from a university degree for a start. So it is a big challenge.
For sure.
So just coming back to the practicalities, how do you think schools or home economics classes could use your findings to better educate students?
Yeah, so I do think there's probably like even though our research was very broad, there are some, I guess, tangible things that it could suggest for what we could do going forward. So one really key finding that we did identify was that adolescents in particular really like to be involved in the design process and also their own interventions. So I think letting young people lead the charge in the things that matter to them and just listening to what they look for is a really big thing. Making sure that they almost feel a sense of ownership and also agency in making their own decisions. So even if you are like looking at holding some sort of nutrition intervention for adolescents, including them in focus groups and surveys to see specifically what kind of matters to them. For example, by having a look at what platforms they use and what formats they are likely to receive well is a really big thing, rather than kind of telling them what to do and where to go. Can be really helpful. Another thing I think is as well, like we also looked at which features are the most effective digital sources used in terms of conveying healthy eating knowledge and or behaviors. And we identified three. So that was accessibility, personalization, and active engagement. So the sources that adolescents found to be accessible, like easy to access, whether it be on their smartphone or different devices. Also personalized, so ones that, for example, had a chatbot feature where they could specifically ask their questions and have them answered, and ones that were found to be engaging, like if they used gamification or something like that, if there was a token system or just something to keep them engaged and interested, were the most effective. So incorporating some of those elements or looking at interventions that potentially leverage some of those techniques could be really helpful, potentially even applicable in other health interventions, but definitely something to keep in mind, especially, even in the classroom. The other thing, I guess one last thing, is probably embracing digital environments rather than discouraging them, especially as technology continues to grow and become a more prominent part of our lives. It can be used, I imagine, hand in hand to educate and potentially even enhance existing interventions. So probably leaning into that, identifying which sources are relevant and adolescents use, and even engaging in open conversations. Like a few of the studies that we looked at also examined, like if they were multimodal interventions, maybe there was a digital component, but there was also an intervention or aspect of it that was taking place in the classroom or with a teacher or a discussion with a parent. And they tended to be quite successful as well, even though that isn't something that we specifically focused on. So I'd be really curious as well to see some more research in that area.
Thank you for that, Talia. I just want to move on now to hearing a little bit about your placement at Alice Springs Hospital. What were your first impressions when you began your placement there?
Yeah, so I was in Alice Springs for 5 weeks, right at the end of my degree, so in October, and I wasn't really entirely sure what to expect. I guess just as a bit of a background, personally, I was never particularly drawn to working in a hospital, so that was something I was a little bit scared about, but I was very excited to go to Alice Springs, especially since I grew up in remote Western Australia, so a little bit similar to home for me. And I was there for 5 weeks and I absolutely loved it. It exceeded my expectations in every way. It was really exciting to go somewhere new and to a different state. I hadn't really been to the NT before, so that was amazing. And it's actually a really big teaching hospital in Alice Springs. So I ended up meeting a lot of other people from other universities who were also on placements there from all around Australia. Everyone was so welcoming. We were very well looked after. And it was a team, given Alice Springs actually has some of the highest rates of like kidney disease and diabetes in the world. It was there were a lot of dietitians working there, so it was really cool to be part of a big team, which is not something that you see very often, as a lot of urban hospitals may only have one or two dietitians.
So your other placements, were they weren't in the hospital, they were in different settings, is that right?
So I did have one other placement in a hospital, but it was in an outpatient diabetes clinic, whereas this one was inpatient.
Okay, and biggest challenges when providing nutrition care in a remote setting. Can you comment on that? What were some of your challenges when you were in Alice Springs Hospital?
Yeah, so food insecurity for one. Unfortunately, there is a lot over in Alice Springs. A lot of a lot of people were coming straight from communities, and many of them didn't even speak English. So it was quite tricky learning how to communicate with people. And to be honest, a lot of the things that we were taught in university just weren't appropriate for this population. As I mentioned, a lot of people had come to communities, and I would estimate probably about 90% of our patients were Aboriginal. So there was just different foods, and for example, we just interacted differently in terms of the questions that we were asking and things like that. It was a much more informal process, and I really enjoyed it. I learnt so much from that as well.
And I imagine you talk about food insecurity. I guess the cost would be a big factor. Which did you find that the fresh fruit and vegetables, like when you're looking at a head of broccoli versus, I don't know, something that's more packaged, was there a big difference in the price of what we'd call core foods versus the non-core foods?
I was expecting there to be a little bit more, but if you went to, there was like a Woolworths and a Coles there, and they
Okay.
were pretty on par. But if, for example, they were located right in town, and if people didn't have a car, or we're in a community, it's a little bit of a different story, because they'll be going more to like the smaller grocers, which I did find were a lot more expensive. So it really just depends on how able people were to transport.
So just leaning on that and thinking about adapting recommendations to suit your patients or clients living in cultural and community contexts. Can you talk about your adaptations?
Yeah, so I guess just leaning on food security being an issue, because a lot of people from the local communities were traveling to Alice Springs Hospital. Sometimes in the communities there wasn't much access to food. So when people did get food, and if their family came with them, they would really want to share it with everyone else. So that's something else that we did need to consider. And also look at as well, especially if we were sending someone home with meals, telling them that this is really important for their health and their recovery, that they need to eat this food. But also, like, as I had mentioned, a lot of people didn't speak English, and also didn't read. So we were relying more on picture formats. And our food recommendations were different. So, like, our dietetic tools were very different to what I'd been taught to use in university. For example, a lot of the time we were just trying to get people to eat. So it might not have been the number one most nutritious option, but if they liked baked beans on toast or tin spaghetti, then and we could get people to eat that, then that was a really big win.
Yeah, okay. So, did you learn much about Aboriginal food practices or traditional foods during your placement?
Yeah, I did. So because I guess we were learning a lot off our supervising dietitians who were there, and as I mentioned, there was a really big team, which was absolutely awesome. I'd also gotten to see the tools that they had kind of developed, and the foods that local people were eating. So as I had mentioned, a lot more tinned and canned foods were also included, just for them to be a little bit more accessible. We also recommended a lot more like kangaroo and things like that. And I did do some cultural training, and even in my own time, for example, exploring around town, there were a couple of talks on food, and I really tried to embrace what was available and taste test some of like the local bush foods. and have a look at what was kind of offered in the community as well. Like one day we myself and some other people from the hospital ended up going and cooking a kangaroo tail, which was a really awesome experience to try as well.
Was it tasty?
Um, it wasn't the tastiest thing. I think we had not cooked it correctly, so it would have been great to have someone with a bit of better knowledge of that. But it was really great to try.
A good experience. Okay. Can't say I've tried kangaroo tail. I do love kangaroo meat. So were there any assumptions or ideas that you had before your placement that changed afterwards?
I think I just expected, I guess, as I had mentioned at the start, I was a little bit intimidated by the hospital experience. But I was so surprised when I was leaving Alice Springs. I was actually really sad to be leaving my placement there. I really, really enjoyed it. Everyone was so lovely and so friendly, and you just felt like you were genuinely making a difference. So I think that is one thing in particular that surprised me. Like I never thought I would say that I would love to work in a hospital, but I would honestly love to go back and do a stint there.
That sounds amazing. Talia, you presented your research at a national conference. What conference was that?
So I actually presented. I presented it too. So I presented at the Dietitians Australia Research Summit, and I have also presented at the Nutrition Society of Australia conference.
Oh, great. Okay. And how was that experience?
Yeah, it was fantastic. The first one I presented I did an oral presentation on the full paper. So that was really exciting for me. I had 10 minutes to talk about my research, and then there were some questions. It went really well. I did end up winning an award, which was very exciting for my presentation. And that one was in the Gold Coast. So the second one was a little bit different. I presented a poster, so there was no talking involved. And that was very exciting as well. I guess it was a great experience seeing what goes into making those presentations. As sometimes, I've attended them myself, but being a presenter was on the other side was very cool.
Just one final question, Talia, on your research. How do you hope it will influence future nutrition education or policy? Do you have any kind of hopes for where we can go in terms of the information sources for adolescents in terms of nutrition?
For sure. So the biggest thing that I would love to see, especially now that I am working as a dietitian, is how digital sources are integrated into existing interventions. And like that is something I would genuinely really love to see. I think it will happen. And I think it'll just be leaning into the change and embracing it. I think AI in particular is really exciting, but I would love to see us working with it a little bit more rather than working against it. So I think that's probably my biggest hope for the future with my research, is how can we best integrate technology to make really effective interventions for young people.
Talia, thank you so much. I've asked all of my questions. I'm going to just leave a minute or so for anyone in the audience. If you've got a question, you can type it in the chat function, or just take yourself off mute and you can ask your question there. I do have some other thoughts, but I'll hold off on those until I hear whether anyone else has got any questions. Hi, Leanne. Did you have a question or comment?
I do have a comment and a question. And I was going to say I've really, really enjoyed this Q&A. So thank you, Talia, and thank you, Peter. But Talia, I was wondering, and you've kind of you've talked about AI and so forth, but are there any gaps you think in your research that perhaps other people could explore or you could explore if you're going to do further research?
Yeah, to be honest with you, Leanne, thank you for the great question. I think there are so many gaps, and that is really exciting. There are many, many areas that could be picked up in future research, and I have no doubt that they will continue to be. I think probably one really big limitation of my research was that it was so broad, and I guess that is just the nature of doing a scoping review. But I think it would be really exciting to hone in on that potentially with more systematic reviews and see what specific digital sources are looking at, like really honing in on social media, for example, seeing which social media sources, also evaluating the quality of the information presented and how adolescents are accessing that, like whether they're searching for images, whether they're looking for specific influencers or the most liked posts. It would be really interesting to see that kind of thought process as well.
Thank you. That's great.
Thanks.
And well done on your award for your presentation as well. That's a huge pat on the back. It's fantastic.
Thank you. I'm very lucky. Scholarship played a really big part in allowing me to partake in those things.
Talia, I'm just going to touch on a comment that you made at the beginning of your presentation, and it's something I often think about as well. And that the fact that in adolescence, it's a really critical time in terms of developing nutrition information and nutrition knowledge, and eating practices and that balance. And I know it's a topic that's being researched at the moment. I know we got a survey through the HGIA in terms of how nutrition professionals are teaching it or would like it to be taught. Can you, maybe this is more from your professional background as a dietitian and dietitian student or a dietetic student, how do you think we best approach that in terms of, we want to advocate healthy eating, but obviously we've got to do it in a very careful way because we don't want to have unhealthy eating practices either. Can you comment on that? Have you got any thoughts on that aspect?
So I think, coming down to engaging in open discussions is a really big thing. Rather than specifically telling people what they should do, it's leaning into what they already know and how can we expand on that. I think eating as well, it can be in adolescence especially like something that everything's learning. There can be additional pressure to and I think some people often feel like they could be judged for doing or not doing certain things. So really just embracing that we're all learning and no one's perfect. And what can we do to make things better, and just making sure that people know that they, should be eating their 2 and 5 a day, that dairy is really important for bones, and to not really eliminate anything, and also just how to navigate social media and any nutrition information that they are thrown at, I think is a really big thing too.
Yeah, thank you. We are all learning, aren't we? And the strength-based approach, how this is positive, but we are all learning, definitely. Thank you for that.
Thank you.
I don't see any questions or comments come up in the chat function. Talia, I'd just like to conclude by thanking you so much for giving us your time this evening, and congratulations again on your wonderful achievements. And we really wish you all the best with whatever's coming up next for you. And we look forward to maybe hearing more about your research or other work that you've got that will be happening in the future. So thanks so much, Talia.
Thank you so much for having me. It was fantastic getting to share that all with you, and also just the future scholars. So thank you.
Thank you, Talia.
Thanks, Talia. I've just popped in, Peter. I think, Talia, you're based in Sydney. Is that correct?
That's correct.
And I'm just going to do a plug for the HGIA conference. We've got our national conference coming up in July in Sydney next year, and Peter is on the academic program committee, and we would certainly be encouraging you to perhaps put in an abstract or something to present, and that will be coming out later in the year. So sorry to do a bit of a plug for HGIA's conference, but we always are looking for fantastic speakers like yourself, and I know our members would really value the learnings from your research, which I've found really, really insightful. So thank you.
Thank you. I would absolutely love to. So I'll keep an eye out for that.
Thank you. Thank you.